Hi, this is Cassidy and Aliana, and we're going to talk to you about trauma-induced hearing loss. About 22 million American workers are exposed to dangerous noise levels at work. The safe noise level is 70 decibels. For comparison, heavy traffic is about 85 decibels and firearms can range from 140 to 165 decibels. Because of how modern life is, with all the new sounds and factories, trauma-induced hearing loss has become more and more common. Multiple sorts of trauma can contribute to this hearing loss. The most common are a continual loud noise, for example, working in a factory, a sudden loud noise, like a gunshot or explosion, and physical head injury, like getting hit in the head or getting poked inside the ear.
Physical injury can cause damage to various parts of the ear. For example, ruptured eardrum. It is also possible to
So just end it and then press. Trauma-induced hearing loss can cause many symptoms. The most common is difficulty hearing, particularly when there are quiet or high-pitched tones, like a woman or a child's voice. It's also very hard to hear when there's background noise or when multiple speakers are all talking at the same time. Consonants, particularly the letters S and F, are also really hard to make out. Tinnitus is the ringing or clicking or whooshing noises that one might hear. This is a common symptom and may also result in nausea or headaches. Hyperacusis is the extreme sensitivity to sound. Another symptom could be bleeding or bruising of the ear, or the need to speak loudly or even scream. Excessive noise damages hair cells. Naturally, we have about 16,000 hair cells. About 30 to 50% of these cells can die before hearing loss becomes detectable. Tinnitus is caused by the bending and breaking of hair cells. This causes them to leak or send random electrical impulses. These impulses are what people with tinnitus hear as ringing noises. Excessive use of the hair cells, for example, from noise, bends the hair cells, which makes them look almost destroyed. Hearing loss can also result from injury, for example, a ruptured eardrum or broken bones. This impedes upon the amplification and transportation of vibrations to the cochlea, resulting in trouble hearing.
Protecting your ears is very important. This includes decreasing the duration and intensity of loud noises. Using earplugs or earmuffs is also very important. Avoid recreation risks. This can include loud industrial equipment, high decibel sounds that continue for a long time, and gun ranges. It is important to take precautions in protecting your head as well. This includes wearing a helmet when you're on a motorcycle or playing a sport. Also, always remember to wear your seatbelt when driving. There are many ways to diagnose trauma-induced hearing loss. A physical exam will look for structural problems. The tuning fork test helps detect hearing loss and find ear damage. The whisper test can also be administered, as well as the audiometer test, which needs to be done by an audiologist and is used with tones. General screening tests and app-based tests are also possible. That's not.
As we mentioned earlier, sometimes trauma-induced hearing loss is permanent, but sometimes it's temporary or treatable. Possible treatment strategies include surgical procedures, which is often done to the middle or inner ear when those parts of the ear are damaged, or the use of hearing aids or a cochlear implant, which amplify the sounds and strengthen hearing. With tinnitus, there are also many possible treatments. For example, electrical stimulation to the inner ear, biofeedback, or different types of therapy, including relaxation therapy. Thanks for watching!
Don't forget to protect your ears.